antibiotics. So let's start with the broad spectrum. This is, from what I've learned, is both siya like not sticking to one lang iyang makaya o eliminate. So the action inhibit of enzyme in cell wall synthesis and bactericidal yang effect. Always get sample culture before starting administration on the patient. So side effects niya hypersensitivity, anaphylaxis prior to superinfection, candidiasis, vaginitis, floor of the body is disturbed, nausea, vomiting, disease. So penicillins, broad spectrum, we have penicillins and cephalosporins. So that's why giwasa din na sila kay broad spectrum sila. So decrease the effect of oral contraceptives. That's why we take food ani to avoid GI upset. That's why iyang yung gi-highlight ang penicillin mukaon take tag food to avoid GI upset. We have example penicillin G, piperalazine, tazobactam. Nakalimot ko unsay naaana niya ni piperalazine, tazobactam. Anyways, si cephalosporin can cause C. diff, does not treat C. diff, okay? Can cause C. diff and does not treat C. diff. This is one of the most kanang common nga mistake ta. Makakause actually siya C. diff and not treat C. diff. Take with food po siya to avoid GI accept. Example kay cefazolin. Wait lang, kay sakit akong pakoglamok. Nabay mga specifics ani nila, cefazolin, ceftriaxone, cefepime? I don't know. So, let's go on sa macrolides. Suffix niya is thromycin. Macrolides, thromycin. We have azithromycin, erythromycin. Side effects niya, increased cutics interval. Yes, nakakita ka siya sa kuan ani sa video. Maka-increase siya QT interval and hepatotoxicity. So, that's why we monitor for cardiac arrhythmias. Think nato siya kay throw ng the QT interval. Take on an empty stomach with full glass of water. Empty stomach na to ikaon ang macrolides and no food, unlike sa cephalosporin ug penicillin nga with food. Watch po na to ang LFT, which is erythromycin and azithromycin high doses with, this is liver function test na siya, and in high doses with other hepatotoxic drugs can cause hepatotoxicity. So let's move on to tetracyclines. Ang tetracyclines di ay kay suffix niya is cycline, di parehas ni macrolides nga thromycin, murag layo ra kaayo. So tetracycline kay cycline lang iyahang kuan kaning suffix. Side effects niya is discoloration of permanent teeth, tongue, nails. That's why we give it to not to children 8 years below. So, photosensitivity pod ang makakause ani niyang tetracyclines. We have nursing consideration. Tetracycline doxycycline. It take on an empty stomach with full glass of water. So, same siya na take sa macrolides. That's why giusa siguro ni sila nga i-take nimo siya with full glass of water and no food. Teach patient to sit up 30 minutes after taking kay na siya risk of esophagitis. And do not take with calcium iron kay maka-decrease siya og absorption. So tetracycline ha, dili ka mag-take og calcium iron kay maka-decrease siya og absorption. Teach to wear sunscreen and skin protection because again this is a photosensitivity, can cause photosensitivity. And also ang T niya stands for teratogenic. That's why teratogenic, empty stomach, teach to wear sunscreen. Ayan. So let's move on with nitromidazoles, which is kauban ni siya ni sulfonamide sa book, but nganong usa siya sa azoles, which azoles is a asa dapit si azoles na belong. So, nitromidazoles is for STI, trichomoniasis, BV, buoyant joint, lower respiratory infections, endocarditis, septicemia, C. diff. Metronidazole. Dazole ang iyahang suffix. So, avoid alcohol during treatment. Kay, dapat 3 days after pa ka, gamay lang na sip of alcohol, dili pwede. I-take na to ni siya with food, same sa penicillin and cephalosporins. And, makakause siya og Stevens-Johnson syndrome. Ngano man, report immediately if na unusual rash or blisters. Mo pa nagiingon ni Nurse Sarah lagi. So, urine discoloration and metallic taste are expected symptoms. Expected lang na sila ha. Ayaw mo kurat. So, azoles is, suffix niya is azole. Ang therapeutic use niya is treatment of systemic fungal infections. Most common yeast infection and cryptococcal meningitis. So, example niya is fluconazole. So, ang kaning azole is nabilong na siya sa mga fungal, fungal. Azoles, polyenes ba to? Yeah, kasi amphotericin B og sinistatin. So, si azoles kay iyang kuan, example kay si fluconazole. Okay? So, treatment of systemic fungal infection, most common yeast, and cryptococcal meningitis. So, i-watch nato ang LFT, bun, creatinine, wash hands before and after administration of topical cream. So, azole di ay kay manaa siya topical cream, same atong napoy patch sa fentanyl ba to? Or to F man to? So, wash hands before and after administration of topical cream. Teratogenic ni siya ha, only given when benefit outweigh the risk. So, contraindications niya kay penicillin, digoxin, anticoagulants, bawal ni siya. But, you can administer man good ani topically. So, highly toxic sila na murag wala tani na discuss. Ay naa, ayan. So, MRSA, C. diff, di ba sa kuan nga po ni sa cephalosporins na ay kuan MRSA, C. diff. Serious respiratory skin. So, I think ang highly toxic, so may meaning sa ABX. Highly toxic kay ang glycopeptides which is vancomycin o aminoglycosides nga gentamicin. It is a sin to give DT toxicity. So, serious respiratory, skin, and toxic to the kidneys, ears, and liver. Kidneys increase BUN, increase creatinine, decrease urine output. Ears kay magkakos og vertigo, tinnitus, or ringing sa ear. Monitor na tong peak and trough level sa both ni siya glycopeptides and aminoglycosides, yeah. Levels is 15 to 30 minutes before giving, and yeah, ano na sa throw. So, monitor IV site every 30 minutes kay very potent. That's why ang vancomycin okay, makakos na siya Gradman syndrome. Oh, sudden onset rash, flushing, hypotension, tachycardia. Looks like allergic reaction eh. So, slow the infusion rate over 1 hour. Slow ni mong infusion rate over 1 hour. So, not deadly. Not deadly man ang Redman syndrome ha, pero slow na to siya. Sakit man daw kaya na siya good. So, aminoglycosides. So, ayun. So, highly toxic ni sila. Therapeutic use. So, like, toxic kay sila, di ba? So, like, ang ila pong use kay for toxic things like MRSA and C. diff. And, so, ayun. Glycopeptides. Pinaka-example niya is vancomycin, which is makakause siya Gradman syndrome. So, sudden onset rush of flushing, hypotension, tachycardia, Muna siya, that's why we slow the infusion. And aminoglycosides is a very, ano po di ay, like, very toxic, pero dili siya makakause og Redman syndrome, vancomycin naman. So, ang example niya is gentamicin, tobramycin, which is highly toxic if given with vancomycin. So, ayaw itaw ninyo i-mix ang gentamicin o thrombamycin. So, we also have sulfonamides, which is sulfa. Ako, actually, muna akong pinaka-favorites. Just something with this is makes me wanna listen. So, for UTI, chlamydia, acute otitis, pneumonia, meningitis. So, trimethoprim, sulfa, TMP, SMC, 1:5 ang ilang ratio. And teratogenic siya. Increase nimo ang fluid intake because it can cause crystalluria. Sulfonamides detong crystalluria, guys. And take twice daily with a full glass of water. No food. Same sa macrolides and tetracyclines. So, kanin dire ha, kanin dire. No food. Sulfonamides, no food. And fluoroquinolones as well, no food. Avoid prolonged sun cause, it's photosensitivity causing. And fluoroquinolones, guys. This is a therapeutic niyang use. Is UTI, gonorrhea, gastroenteritis, and akong ano niya is si Cipro og si levofloxacin. Iyahang kuan fluoroquinolones, iyahang suffix is floxacin, which akong ma-remember lang is si Cipro jud og si levo. Si levo is for respiratory, si Cipro is kalim mo unsa man gani na si Cipro. Hoy. Ano ka ba? So, take no food, guys. Take no food. And okay, so fluoroquinolones di ay itong makakause og increased risk of tendon rupture. Fluoroquinolones itong makakause og increase og tendon rupture. Again, fluoroquinolones ang makakause og increased risk of tendon rupture. So avoid prolonged exposure to sunlight as well as sulfonylureas. So we have key takeaways. No food with water only is move the food, macrolides, tetracyclines, and fluoroquinolones. Okay? Move the food, no food. See macrolides, tetracyclines, fluoroquinolones. And avoid the sun is finish the entire prescription. Tetracyclines, sulfonamides, and fluoroquinolones. Tetracyclines, unsa ganito sila? Dili lang dapat sedation ng imong ma-think has. For ano siya, katong mga ang bata, then nagbike ang bata, bawal sa bata, and like, bawal po siya nimo i-take sa calcium, kay maka-decrease og absorption. Ayun. So, avoid the sun jud taan nilang TSF. Tabang san falayo. Tabang san falayo kay avoid the sun. And extremely toxic is like mycin and mycin. So like mycin is like vancomycin and aminoglycosides is gentamicin. Very toxic. And teratogenic is TSA, tetracycline sulfonamides and antifungals, which is ang antifungal nato diri ang azole. Antifungal diri ni siya, which is teratogenic ang azole, guys. Oh my goodness. Magka-fungal infection ka niya na kay baby. Oh my gosh. Saan ka? Grabe ka lisod. On to antivirals. So, sa antivirals, ang acyclovir kay nephrotoxicity and neurotoxicity. And ang ganciclovir mo ang for risk for bone marrow suppression. We also have topical, which is topical na to ang itopical na to magwear ta gloves, and acyclovir is for kids.